Welcome to Lightup, this platform where you get information, try to really kind of digest the information, then use it to inform yourself, get engaged, talk to other parents, talk to other people in the community, and at the end of the day, so we can help each other. I know I've talked one of the topics that I've raised in the past regarding mental health, but I'm going to make this very short, and it's really a question to you. Maybe to help you kind of dig deeper, do some kind of inquiries, do some kind of questioning, talk to your peers, and then find the experts to talk to you to give you more information. And this is the question: what does mental health look like? Does mental health have a face? And if it does, what does that face look like? When we talk about mental health and well-being, what exactly are we talking about? How big is this subject? Okay? Because other than putting imagery around the topic mental health, that which we assume we know, or that which we've come to believe that it is what it is, there is a big wealth of knowledge, and that can benefit us, an understanding that we need to get. And for the benefit of our children especially, and our loved ones, it's important for us to discuss this subject in today's world, in our societies today. Because what is happening is that mental health disorders, I would treat them as one of those silent epidemics. They are there in big numbers, but we are not talking about them enough. We are not engaging, and largely, most of us are ignorant about everything. Meaning we don't even know how to spot anything, we don't know how to tell one from the other, and in that regard, we wouldn't even know when to seek help, how to seek help, and from where we can seek help. And here is another thing that really concerns me. It's not isolated to a particular set of individuals. When we talk about mental health, it cuts across. And right now, a lot of our loved children are having mental health disorders. Those we can't tell, those we can't spot, but life goes on as normal. And that's why I was saying it's a silent epidemic. One that we really need to react to, and where we need to have the starting point as getting the information and getting an understanding. So let me just read to you a simple list of some of the mental health disorders that exist out there according to experts. And your job, once I've read this list, will be to take that up, go and ask what that means, what these disorders present as symptoms, as signs, and how can I spot it, where can I get help, and do these disorders only happen in certain age brackets, or they happen across? The responses and the revelations that you'll pick about this will be telling. That much I can tell. That much I can guarantee you. And then it will give you a good perspective that this is a subject worth investigating and exploring so that you get the best out of it. So, in terms of disorders, when you talk about mental health, beyond the facade of us understanding people, undressing themselves and getting psychotic breakdowns and episodes, we really have categories of mental health disorders which exist, I promise you, in our homes, in our neighborhoods, in our communities, in places of work, in all the other social circles that we have. So just pay attention to these. And as I said, I'm just going to read a list. Take the list. Take an interest, talk to a specialist, a psychiatrist, a counselor, a general physician, a doctor. All these people should be at least at the very basic able to give you some kind of information about some of these disorders. We have like anxiety disorders, behavior and emotional disorder in children. I'll say that again. Behavior and emotional disorder in children. Bipolar affective disorder. When they say that that person is bipolar, that's a disorder. Depression, that's very common. And if you listen to most of the men talks that are going on around, they all talk about depression among men and the like for so many reasons. By the way, that doesn't mean that it doesn't exist in women. When I was doing some work of advocacy of promoting friendly maternal health care and respectful maternity health care, that's when I learned about a terminology which was postpartum depression. Women who go through the 9 months of having a pregnancy, then labor, that there are so many women who suffer from postpartum depression. Just go out there and find out what that means. You will discover that some of the signs of such mothers, new mothers, would be that they don't want to touch the baby, they don't want to carry the baby, they don't want to breastfeed the baby. Those are some of the things I can recall off head that the nurses and the doctors were telling us. But I'm not an expert. Go out there and find out. Disassociation and dissociative disorders. There is eating disorders, paranoia. You see people that don't exist, that are not there. You say there are people in the house, but there is none. And I'm just picking things because I'm doing the deep dive on my own. You need to do the same. Then post-traumatic stress disorder. Okay, one of the examples I can give people who usually show signs of these are people who've been in war. Okay, not only soldiers who've gone to war, but look at people who are in Ukraine right now. Okay, or people in Palestine, in Gaza and the like. Many of these, if you go to talk to doctors, they'll tell you that these people are now suffering from post-traumatic stress disorder. There is psychosis. And then we have schizophrenia. All these. If you find someone who tells you that they don't feel comfortable when they're in tight spaces, okay? These are the kinds of people who can go to a room, it's a small room, but everyone is there and it's full of people and they're talking and the like, and someone tells you, I don't feel comfortable sitting in here, you know? I'm not saying it's a guarantee, but people who are claustrophobic usually don't like being in tight spaces. So such a person can find difficult, for example, traveling on a plane, sitting in a very tight room, sleeping in a small room. You will realize that they can even begin to run out of oxygen. You feel that they are breathing heavily and the like. When you go into the world of mental health disorders and you just go into the list and so many other disorders that I've not talked about, that can in part explain why at some point in Uganda they said that there are 14 million plus mental health cases of Ugandans. There is so much that we don't know about this subject, but for me the primary interest and for the benefit of this interaction and engagement conversation, why I talked about it is because there are so many of our children who are going through things we don't even understand. Sometimes we don't even know we are the cause and we can't even tell. So meaning we are not getting them the help they need, and there are a lot of things that are going on inside them, you know? And at the end of the day, that might explain some of the things that you see people do that are drastic, that are fatal, that are unfortunate. So take an interest. The reason why I raise this is to ask the question, how well do you understand the subject of mental health? There are people who can support you to get all the information you need, and they should be able to help. Thanks for watching. Till next time.